Learning about the body anatomy and how to use the different parts of your body for dance is one of the most important tools for you to actively enhance your dance training and improve your technique. Dancers that understand their bodies and are aware of how they use it become smarter dancers. Starting to train dance technique at an early age has both physical and mental advantages. Studies suggest that young minds are more adept at learning new languages, and dance is certainly a language. Kids certainly retain new information better than adults, observes Damara Bennett, director of the School of Oregon Ballet Theater. Even starting at a young age, dancers need to start learning dance anatomy to better understand their bodies during performance. The more a child understands how the body functions, the more they can develop a sense of their whole body. This ties directly to performance. As a dancer learns how to plie before they can jump, so they must understand how the knee and the ankle joints allow them to bend the legs while also avoiding injuries. In order to generate movement, we use our bones and our muscles along with many other body parts. The most important attribute of muscles is that they are made up of contractile fibers. They change their size to produce movement, and both their possibility to contract and expand is what creates their efficiency. Our skeletal system gives the body its shape, which changes with growth. Our bones are the main reason why we can keep a certain shape as humans and also change them. In order to dance, there are certain sets of motion from our bones that allow us to perform specific dance technique elements like turnout. Hip rotation, or turnout, like we call it in dance, is the action of rotating our hips and our legs to try to reach the most open angle we can, from our hips to our knees and ending in our rotated feet. Most dance shapes and elements comes from turned out positions like the ones shown in this picture. But turnout does not come from just spreading our toes and bringing our heels together. Bone movement and the support of our muscles are the ones in charge of allowing us to perform the best turnout possible, or in another way called rotation. There are three very important elements involved in the bone structure of a turned out position of our hips and legs: the hip socket, the head of the femur, and the greater trochanter. When bringing our legs to turned out position, we have to think of bringing our greater trochanter towards our sits bone, like the image is illustrating. But muscles, on the other hand, they are the superheroes of our bone movements. They take most of the hard work about this performing action. There are a bunch of muscles to consider for performing rotation or turnout, but you don't have to worry about the crazy names. In dance, we work a lot in our leg raises, better known as leg extensions and lines. Our quadriceps, hamstrings, and gluteus work all together to perform many of the main movements we perform with our lower body in dance. These three sets of muscles take the most of the effort of the performing action of lifting our legs up when we dance. Our quadriceps will always tend to take most of the effort since it's the biggest muscle, but we have to train our bodies to use other muscles to support our actions and not just leave all the hard work to one muscle. There are other smaller muscles that take action on rotation. Then once we get to know them and understand them, our muscular rotation will improve automatically. These are called the 6 lateral rotators. Again, don't focus on the crazy names. Just use these images to try to understand how these muscles help to rotate our legs. Your hamstrings, which are the muscles that are located in the back of our legs, will take a lot of the action as well in order to lift them. For our rotation to occur, dancers must think of driving our hamstrings inwards to meet with each other. Our inner thighs will do the opposite than your hamstrings while performing towards turnout. Inner thighs should pretend to go forward and out, away from each other. These motions are not seen specifically as we describe them, but it is the feeling of a dancer should get while trying to turn out. We do not need to squeeze our butts or force our ankles and knees to rotate. We must accommodate our bones and use these sets of muscles to do so. Think of the colors of a candy cane and how their spiral lines seem like they never end. Turnout should feel like a constant flow of energy through the hips and legs. In order to avoid injuries in dance, we must learn about our bodies and how to use them efficiently. Most dance long-term light injuries happen because of overusing the wrong set of muscles and joints for a specific movement. A very common injury in dancers is the hip flexor injury. When our muscles get too tired, it is common that dancers start using this little but very strong tendon to lift their legs, instead of the more than 10 bigger muscles that we just mentioned before. When this joint is overused, it can cause swelling and very deep pain. Our muscles and our bones work together in order for us to be able to move and dance. Without one, the other one wouldn't coexist. We wouldn't be able to move our bones without the strength of our muscles and the joints and the ligaments that connect these two together. Learning about your body anatomy will definitely enhance your dance experience. Next time, when you're in class, try to bring to the session all of these concepts and ask your instructor if you have questions on how to physically try to feel these body parts in your own body.